The itch that shouldn't be ignored. An 88-year-old oncologist's urgent warning. After 50 years on the front lines, there are certain symptoms I've learned to listen for in my clinic. Whispers from the body that don't announce themselves with the roar of obvious pain or a visible lump. They are subtle, persistent, and all too easy to dismiss. And there is one, in particular, that I never mention casually at the hospital, because when it appears, it might be a harbinger of something far more significant than a simple skin issue. My name is Dr. Arthur Gable. I am an 88-year-old oncologist, and after more than half a century of seeing patients, of sitting with them through their fears and their triumphs, I have come to understand one profound truth. Sometimes, the body's most urgent message is delivered in the form of an itch. Now listen, folks. Has a certain spot on your body been particularly, stubbornly, inexplicably itchy lately? Perhaps you've tried moisturizing lotions, slathered on ointments, changed your soap, and yet nothing seems to quell the sensation. A lot of people, especially as they get on in years, will simply shrug and say, "Oh, it's just old age." Please, I implore you, do not fall into that trap. I still see patients every Tuesday and Thursday at the clinic. An 88-year-old doctor still on the front lines, pretty amazing, right? But one of the primary reasons I can stay so active and healthy is because I have learned, through decades of experience, not to ignore the body's subtle warning signs. Today, I want to share something of grave importance with you, the potentially life-saving truth behind an itch that just won't go away. The story that changed my perspective forever began last winter. A 75-year-old gentleman, Mr. Peterson, came to see me. His complaint was simple: an unrelenting itch on his lower leg. He described it with meticulous detail. It would only get intensely itchy after his evening shower, and then, like clockwork, it would wake him from a deep sleep around 3 a.m. Lotions and creams did absolutely nothing. At first, my mind went to the usual suspects: senile pruritus, the medical term for age-related itching, or perhaps a form of eczema. But something about what Mr. Peterson said kept nagging at me, a detail that didn't fit the pattern. "Doc," he said, leaning forward with a look of deep confusion, "there's nothing wrong with the skin itself. It isn't red, it isn't scaly, it isn't dry. So why is it so darn itchy?" He described the sensation as coming from deep within, a feeling that was profoundly different from a typical skin problem. On a hunch that went against the textbook diagnosis, I advised him to undergo further testing. The results were shocking: early-stage lymphoma. I will never forget the look on Mr. Peterson's face when he told me, "I just thought it was because I was getting old. I almost didn't come in." That's when it hit me like a physical blow. How many other signals had I, and countless other doctors, missed over the years? Since that day, I have become a student of the itch. I've seen similar, tragic cases play out. A 68-year-old woman with a persistent gnawing itch between her shoulder blades, pancreatic cancer. A 73-year-old man with a constantly itchy scalp that no shampoo could fix a pre-leukemic condition. From that day forward, I vowed to never take an unexplained itch lightly. That night, I began a colossal task. I reviewed my 50 years of patient records. I sifted through thousands of files, looking for this overlooked clue. I found a startling and chilling statistic. Approximately 30% of my cancer patients had experienced a distinct, localized itching in the 6 months before their formal diagnosis. This was not a coincidence. I started researching, poring over medical journals from around the world, and consulting with colleagues in dermatology, neurology, and internal medicine. I identified 6 specific areas of the body where a persistent itch could be a critical red flag for an underlying malignancy, especially for people over the age of 60. It is critically important that you follow this discussion through to the very end so that you can understand the nuances of these signals. The information you are about to hear is not meant to frighten you, but to empower you. It could very well save your life or the life of someone you love. If this video helps you, please consider clicking the like and subscribe buttons. My only goal is that more people can access this vital information. Today, we will cover 2 crucial topics: the 6 dangerous red zones for cancer-related itching, simple, effective self-diagnosis tests that you can perform at home. If a part of your body is currently driving you mad with an itch, please stay tuned until the very end. Part 1. The 6 red zones. Decoding the body's itch signals. Red zone number 1. The lower leg, especially the shin. Potential warning. 4. Lymphoma. Let's begin where Mr. Peterson's story taught me such a valuable lesson. The lower leg, specifically the front part, over the shin bone. If you are experiencing a constant deep itch in this area, you need to consider the health of your lymphatic system and be checked for lymphoma. The why. Lymphoma is a cancer of the lymphatic system, a critical part of your body's immune defense network. When this system becomes cancerous, the malignant cells can release a cocktail of inflammatory substances, including cytokines and other chemical messengers called pruritogens. These substances travel through the body and can intensely stimulate the peripheral nerve endings in the skin, triggering the sensation of an itch. The skin on the shins is thin and has a unique nerve distribution, making it particularly susceptible to this type of systemic irritation. Let's revisit Mr. Peterson's case. For 3 long months, he suffered. It began as an occasional nuisance, but steadily escalated into a nightly torment. At 3 a.m. every morning, the front of his lower legs would begin to itch with such intensity that sleep was impossible. He told me that scratching it provided no relief. In fact, it seemed to worsen the deep, maddening sensation. His wife, deeply worried, had bought him expensive, medicated lotions, but they were all for nothing. How to check yourself at home. The lotion test. If you have an itch, the first logical step is to treat it as a skin problem. Apply a high-quality moisturizing lotion and an over-the-counter anti-itch cream, like one containing hydrocortisone, consistently for 1 week, applying it 2 or 3 times a day. With common skin problems like dryness or eczema, this treatment regimen almost always provides some degree of relief. However, an itch due to lymphoma will not get better. In many cases, it will continue to worsen, completely ignoring the topical treatments. The timing clue. Pay close attention to when the itching occurs. In the early stages of lymphoma, the itching characteristically worsens at night. During the day, it might be a mild annoyance or completely absent, but when you lie down to sleep, it intensifies. This is believed to be because the activity of the lymphatic system changes at night, and when you are lying flat, the lymphatic circulation can slow down in the lower extremities, allowing those inflammatory substances to concentrate. The treatment response. It is critical to note that an itch from lymphoma cannot be cured by creams or even oral antihistamines like Benadryl. This is because the problem is not a skin-level histamine reaction. It is a deep internal immune system issue. If your lower legs are persistently itchy for more than 3 weeks, and this itch shows no improvement with creams and is consistently worse at night, you need to see a doctor and suggest a consultation with a hematologist-oncologist. Lucky for Mr. Peterson, his cancer was discovered in its early stages. He was treated promptly and is now completely healthy and cancer-free. With an early discovery, the success rate for treating many types of lymphoma is over 90%. Have you been experiencing a strange, deep itchiness on your lower legs lately? Red zone number 2, the middle of the back potential warning. 4. Pancreatic cancer. Next, let's talk about a very specific and often overlooked location, a single, persistent spot in the middle of the back. The pancreas is an organ tucked deep within your abdomen, but it shares nerve pathways with your back. When the pancreas has an issue, it can signal its distress through the back. The why. In the early stages of pancreatic cancer, a tumor can block the bile duct. This causes bile, and specifically a substance called bilirubin, to build up in the bloodstream and get deposited in the skin, which can cause intense itching. Furthermore, the concept of referred pain, or in this case, referred sensation, is critical here. The nerves from the pancreas enter the spinal cord at the same level as nerves from the skin on your mid-back. Your brain can get confused and misinterpret the distress signal from the deep organ as an itch on the surface of the skin. The place of the actual problem is different from the place where the symptom shows up. Not too long ago, a patient I'll call Mrs. Eleanor Vance came to my clinic in a state of utter frustration. This 68-year-old woman had tried everything. She had a constant, maddening itchiness at a single point in the middle of her back. She first thought it was an issue with her bedding and replaced her entire mattress. The itch continued. This time, she replaced all her pillows and blankets and hired a professional company to do a full house cleaning, including mite removal. She said to me, "Doctor, we have flipped our house upside down. We threw away the rugs. We even replaced the couches. But I still have that one spot that is just so itchy." I got an allergy test from a dermatologist, which came back negative, and I've tried several types of prescription creams, but it was all for nothing. Mrs. Vance also suffered from a specific pattern of itchiness. The itch was manageable during the day, but it would start to intensify after she ate her dinner. She first thought she was eating something she was allergic to, but regardless of what she ate, the itching started around the same time each evening. How to check yourself at home. The pressure test. With your finger, gently press on the itchy spot in the middle of your back. If the itchiness is related to the pancreas, you will often feel a strange sense of deepness, heaviness, or an unidentifiable discomfort under the pressure point. You'll notice that the itchiness feels different from that of a normal skin itch or a mosquito bite. Check your digestive state. The pancreas is a vital organ that produces digestive enzymes. If the back itchiness is accompanied by poor digestion, floating or pale colored stools, or discomfort after eating greasy foods, you need to be extremely careful. The pain patch problem. The key thing to note here is that a pancreas problem easily signals the back. A lot of people assume it is a normal muscle ache or a pulled muscle. They will apply pain patches or temporarily feel a bit better from massages, but the underlying itchiness will still persist. If your skin looks perfectly fine, but a single point on your back is persistently itchy, do not shrug it off. You need to get a checkup. Have you experienced any strange sensations on your back recently? Red zone number 3, the scalp potential warning. For leukemia. Next, let's talk about the scalp. A persistent itchiness of the scalp, particularly when there are no obvious signs of dandruff or rash, can be an early sign of leukemia. The why. In leukemia, the body overproduces abnormal white blood cells. These cancerous cells can infiltrate the skin tissue. The skin of the scalp has a very rich blood supply and a high density of hair follicles and nerve endings. The leukemic cells release inflammatory substances, including histamine, which directly stimulate the minute nerves of the scalp, causing a persistent and often maddening itch. This is especially true for the areas behind the ears and at the nape of the neck. A patient of mine, Mr. Thompson, stands out the most in my memory. He was 73 years old and a very detailed, meticulous man. He came into my office with a journal. He said, "Doctor, I've been journaling for 3 months and have recorded when I'm itchy and when it gets worse." He first thought the shampoo was the issue, so he switched to one with mild organic ingredients. He then skipped conditioner entirely and switched to a simple bar of soap. He even tried washing his hair every other day instead of daily, but it was all for naught. Strangely, there wasn't a speck of dandruff or any visible redness on his scalp, but he constantly felt an urge to scratch. It was the worst behind his ears. And what's even more strange is that he didn't feel it much during the day. It got significantly worse when he laid down at night. How to check yourself at home. The temperature test. Gently feel your scalp. If it is a leukemia-related itch, the specific point of itching will often feel slightly warmer to the touch than the surrounding areas. This is due to localized, minute, inflammatory responses under the skin. The itch pattern. Pay close attention to the pattern. Itchiness in the scalp, related to leukemia, is often significantly worse at night. Like Mr. Thompson, it might be barely noticeable during the day, but starts as soon as you lie down. This is because the blood circulation pattern changes when you are horizontal, allowing the inflammatory substances to spread out and pool in the scalp tissue. Look for other symptoms. If the scalp itch is accompanied by other telltale signs, you need to be vigilant. Have you been feeling unusually tired lately? Do small cuts seem to take longer to heal? Are you bruising more easily than before? Or are you noticing bleeding gums when you brush your teeth? These are all potential signs of a problem with your blood cells. Have you felt a strange, persistent itchiness around your scalp or neck recently? Red zone number 4, near the chest. Potential warning. 4. Inflammatory breast cancer. in both women and men. Next, let's talk about the area near the chest. A persistent itchiness in this area may be related to a rare but aggressive form of cancer called inflammatory breast cancer, or in some cases, male breast cancer. The why. With inflammatory breast cancer, the cancer cells block the tiny lymph vessels in the skin of the breast. This blockage prevents the normal flow of lymphatic fluid, causing a buildup of fluid, inflammation, and irritation. This stimulates the nerve endings and causes itching. It also causes the skin to swell and thicken, often taking on the appearance of an orange peel, a condition called peau d'orange. Critically, this type of cancer often does not present with a distinct, hard lump like other forms of breast cancer, which is why the early signs like itching are so important to recognize. I want to share the story of Mrs. Adler, who came in for a checkup a few months ago. She is 69 years old and very detailed. She said, "Doctor, the spot where my bra strap and underwire sits has been so itchy, so I thought it was an issue with the bra." Mrs. Adler tried everything. She switched to bras made of pure cotton, silk, and even bamboo. She tried going without a bra entirely and only wearing loose clothes, but the itchiness continued relentlessly. What was strange is that it was only on her right breast. There wasn't any issue on the left. How to check yourself at home. The mirror test. Stand in front of a mirror and closely look at both breasts. If the texture of the skin on one of the breasts looks different, pitted, thick, or like an orange peel, or if one breast seems slightly swollen or larger than the other, or if there is any unexplained color difference, redness, or a bruised appearance, you need to be careful. Mrs. Adler, upon close inspection, had a slight redness on her right breast. The location clue, the spot where the itchiness starts, is also important. Inflammatory breast cancer often starts with an itch or rash around the nipple or areola, or in the fold beneath the chest. In particular, pay close attention if the itch is only on one side. The sensation usually begins as a simple itchiness, but with time, the skin may get thicker or develop that orange peel texture. When you press on it, the skin may lose its normal elasticity. A note for men. This is also true for men. Male breast cancer accounts for about 1% of all breast cancers. It's rare, but it exists. If men over the age of 60 feel a persistent, unexplained itchiness around their nipples, they need to get checked. It is critical to note that if a lump cannot be felt, but the skin is deformed or discolored with a persistent itch, you need to get it checked immediately. Inflammatory breast cancer spreads more quickly than more common types of breast cancer. However, it can still be treated effectively with early discovery. Does anyone here have a persistent itchiness around their chest? Red zone number 5, near the anus or reproductive organs. Potential warning for anal cancer or vulvar cancer. Next, let's talk about a sensitive area, the anus or reproductive organs. A persistent, stinging itchiness in these areas may be an early indication of anal cancer or vulvar cancer. The why. In these cases, a tumor begins to grow and compress the surrounding delicate tissues. This physical pressure causes the local nerves to get stimulated, which the brain interprets as a stinging, burning, or intensely itchy sensation. This is different from the more generalized discomfort of a common inflammation or hemorrhoids. I want to share the story of Mr. Sullivan, who is 66 years old. He has had hemorrhoids for the past 30 years. When he first started feeling a new kind of itchiness around his anus, he naturally thought it was just a flare-up of his old problem. He said, "Doctor, I've had hemorrhoids since I was a young man, so I'm very familiar with the symptoms. But this time, it feels different. Usually, hemorrhoids hurt when I'm sitting or using the restroom. But this time, it itches intensely even when I'm just standing still." So, he applied more hemorrhoid cream and took warm sitz baths 3 times a day. He even went to a specialist who performed a minor hemorrhoid surgery, but afterward, he only heard the words, "Everything looks fine now." Yet the itch persisted. How to check yourself at home. The specificity test. Take note of the area of itchiness. Hemorrhoids or normal inflammation, like a yeast infection, will generally cause a more widespread area of discomfort. A cancerous itch is often highly concentrated in a specific pinpoint spot. A lot of people describe it as the feeling of tiny needles pricking the skin. The pattern of itchiness. The degree and pattern of the itchiness is also different. With normal inflammation, the itchiness usually gets better with appropriate treatment over time. A cancerous itch often worsens with time. It's especially worse at night. Mr. Sullivan said that the itchiness was most intense when he laid down in bed at night, making it very hard to sleep. Look for other symptoms. Pay close attention to any symptoms that come along with it. Watch for any bleeding during bowel movements or any changes in the consistency or shape of your stool. If there is discomfort when you urinate, or if the color and smell of vaginal discharge changes, you need to be careful. The treatment response. Normal inflammation can be relieved by appropriate creams or warm sitz baths. In the case of a cancerous situation, these treatments will not work at all. In fact, the condition often seems to get worse over time despite treatment. It is critical to note that you should never delay getting a checkup because of embarrassment. It is vital to get checked early. Just like Mr. Sullivan, there are a lot of people who ignore these symptoms because they have a pre-existing, non-serious problem in the same area. Is there anyone here who feels a persistent discomfort in this area? Red zone number 6, the hands and feet potential warning. For various internal cancers, liver, gallbladder, etc. Lastly, let's talk about the hands and feet. If only the palms of your hands and the soles of your feet feel intensely itchy, you need to check for a possible internal cancer, such as liver cancer. This type of itch is a classic example of a paraneoplastic syndrome. The why. This is a fascinating and important concept. Sometimes, a tumor, no matter where it is in the body, can start producing and releasing abnormal toxins, hormones, or proteins into the bloodstream. These substances travel throughout the body and can have effects far from the original tumor site. In some cases, they directly affect the peripheral nerves, especially the dense networks of nerves in the hands and feet, causing an itch. This is called paraneoplastic pruritus. This type of itch often only comes about when the cancer has reached a certain stage, so you need to be especially careful. One person who shocked me was Mr. Wallace, who is 70 years old. Only the palms of his hands were intensely itchy. He first thought it was housewife's eczema from doing dishes and got treatment from the dermatologist. He told me, "Doctor, I wear gloves when I wash the dishes now. I even switched to a mild hypoallergenic soap. Why is it still like this?" Mr. Wallace managed it well. He applied lotion 5 to 6 times a day. He even wore cotton gloves to sleep. He thought that maybe he was washing his hands too often, so he started washing them only once or twice a day. He even made sure to only use lukewarm water. Strangely, the backs of his hands were completely fine. Only the palms were itchy, and the lines in his palms were especially itchy. How to check yourself at home. The visual inspection. Closely look at the soles of your feet and the palms of your hands. With an itchiness related to an internal cancer, especially liver-related, the skin color may take on a slightly yellowish or jaundiced tint, and the deep lines in the palms and soles may look more pronounced or deeper than before. In Mr. Wallace's case, the palms of his hands were indeed slightly yellowish. The pattern of itchiness. The pattern is also unique. Usually, both hands and both feet are itchy simultaneously. It's also often worse at night, but better during the day. The relief method. The way you relieve the itchiness is also different. With normal skin problems, moisturizing or dipping the hands and feet in cool water will often help. But these methods do not work with a cancer-related systemic itch. It may provide a temporary, cool sensation, but it will not fundamentally solve the problem. It is important to note that people frequently mistake the itchiness of the hands and feet for a simple skin problem, diabetes, related neuropathy, or poor blood circulation. A lot of people let it go because they are old. However, if only the palms of your hands and the soles of your feet feel intensely itchy, you need to be careful of abnormal peripheral nerve stimulation or a systemic disease. If you are over 60 and experience this type of itchiness for more than 3 weeks, you need to get a complete checkup, including blood work that checks your liver function. Have you felt strange sensations in your hands and feet lately? Part 2. Your personal investigation. A 5-step self-diagnosis protocol. Now that you know the red zones, I'll tell you how to investigate for yourself using a simple 5-step protocol. You will be able to identify a potentially serious issue early if you just remember these 5 steps. The 3-week test. If any localized itchiness lasts for more than 3 weeks without a clear cause, it is not a simple issue. Normal skin problems or allergies will usually get better or change within 1 or 2 weeks with basic care. Get a calendar, mark the day the itch started, and track it. If it goes over 3 weeks with no improvement, you need to see a doctor. The lotion response test. Use a good moisturizing lotion or an over-the-counter anti-itch cream for 1 full week, applying it diligently 2 or 3 times a day. The itchiness should get better if it's just a common skin problem, but if the treatment does not work at all, or if the itchiness actually gets worse, you need to suspect an internal issue. If external treatments are not working, the problem is likely not coming from the skin. The side symptoms check. An itch related to a systemic disease rarely comes alone. Keep a journal. Are you experiencing any other symptoms? Have you lost 3 to 5 kilos in 1 month without trying? Are you more tired than usual? Do you have a constant low-grade fever, you need to get a checkup sooner if you have any of the above symptoms along with the itchiness. The itch pattern analysis. It is very important to record when the itchiness gets worse. As we've discussed, a cancerous itch often has a pattern of getting worse at night and being better during the day. Also, watch out for a specific fixed spot that itches constantly. You need to be careful if the same spot is itchy day after day and doesn't move around to different spots. The family history check. If your parents or siblings have had cancer, you have a 2 to 3 times higher chance of getting cancer yourself. You need to be especially careful if it's the same type of cancer. Do not miss the small signs. If you have a family history of cancer, get frequent checkups and be extra vigilant about any new, persistent symptoms. Confirm the above steps one by one. Thank you for hearing out this long story. Not all itchiness is cancer. In fact, most of it is not. But all cancers start with small signs. Do not just shrug things off with old age. Listen to the signals from your body. I'm 88 years old, and I'm still seeing patients because I know that paying attention to these small signals saves lives. The biggest thing that I have learned in my 50 years as a doctor is that most cancers can be treated and often cured with early discovery. Here's something that you can do now. Check your body tonight before going to bed. Check where it's itchy, when it's worse, and how long it has been going on. Mark a calendar and record the timeline properly. If any of the symptoms that I mentioned today match yours, do not feel embarrassed and do not delay. Go see your doctor and be sure to accurately describe when the symptoms started, the itch pattern, and any side symptoms you have noticed. Your health is the most important thing you have. Money and fame are not as important as your health. Let's make this video the first step towards keeping your life safe. I hope to tell you in the next video the warning signals behind the most common symptoms of old age. There are a lot of things to be careful about with symptoms like joint pain, poor digestion, and headaches. If you want to share the valuable information that I've mentioned today, please like, subscribe, and put on the notification bell. That way, you can get more information faster. And please share this video with your loved ones. I hope everyone stays healthy. If you start now, what kind of life will you be living next year? It will be a more healthy and energetic life.